Hi, good evening everybody. Tonight's session is about golfer's elbow, and the things I'm going to cover is I'm going to look at who gets it, how do you get it, what it feels like when you have it, what other conditions may feel similar to golfer's elbow but isn't, and you may need some different treatment for that, what causes golfer's elbow, tests you can do to test for it, and then lastly we're going to look at all the treatment options available if you've got the condition. Now, my name is Maryke. For those of you who don't know me, I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment for your injuries. If you want to check out the website, links in the description of this video. Now, I'm really sorry if you expected this video to be a live stream tonight, but my internet speed is just too slow. It would take forever to upload, so I couldn't do it as a live. If you've got any questions when watching this, just ask them in the comments and I'll come back to them. And if you're watching it on Facebook, make sure you tag me, then I definitely won't miss it. But you're always welcome to message me, email me, whatever you want to do if you've got questions about any injuries. Excellent. So let's dive right in. Let me find my first slide. Cool. So who gets golfer's elbow? Now, it's just like tennis elbow, where it's called golfer's elbow, but I haven't seen many golfers through 16 years of practice with this condition actually. So golfers do get it. People who play racket sports, so even tennis players can get it. Any sport where you grip, basically, you can get it. Baseball pitching, also quite a common cause for it. But then people who do weight training, lift heavy weights. And the most common patient group that I actually see in practice is people who do hard physical labors, like your carpenters who does repetitive hammering, because it's any condition or any activity that is heavy work. So you're gripping really hard and you're doing heavy work with it. It's repetitive in nature, so you repeat that action quite a few times. So if we think of weight training, it's the guys who does a lot of heavy lifting and they've really ramped up the weights and things over the last few weeks or months, and they do it quite regularly. Then people who are overweight seem to get it more often. Smokers, and that's to do with tendon health. So if you're smoking, your tissue can't renew so well and can't repair it so well, so you're more likely to get tendon type injuries in any case. And then type 2 diabetes, and that's actually also a risk factor for all other types of tendinopathies, because golfer's elbow essentially is a tendinopathy. It's also known as medial epicondylitis. There's another epi one which I can't even pronounce. All of those things are the same condition. So golfer's elbow, medial epicondylitis. Can't remember the other ones now. There's plenty of names for it. So what does it feel like when you have tennis elbow? The pain is pretty much, let me just get an arm that you can see. There we go. Located to your medial epicondyle, which is the knobbly bone that you can feel on the inside of your elbow joint there. So if I pull my shirt up, so that knobbly bone there, that's where the tendon attaches that gets this condition. And it is the muscles in the forearm, so it's all the muscles that flex the wrist, but also the one that turn the wrist over, so does that action, pronation. They all come together in one tendon. So all those muscles come together in one tendon and it runs around in that area, and then it comes and attaches on your medial epicondyle of your humerus bone. And most of the pain is situated there. But now I can tell you, for people with a really acutely flared up tendon, I've had it that the pain spreads all over. So that will be the main pain, but it can be all over. You can have tingling down to the wrist, because your ulnar nerve runs right there as well. So if these muscles are really tight, why am I struggling to get my arm in here tonight? It's a little bit more to the side. You don't need to see my face. So if these muscles around this area is quite tight, it can pinch your ulnar nerve, and that can then cause tingling all the way down to the hand as well. Also, your median nerve runs through the middle kind of your forearm. So again, if those muscles are really tight, it can hold on to that and give you tingling kind of more into the middle of the hand. It can be throbbing at rest if it's really aggravated and sore. And you usually have pain with gripping articles or with turning and twisting movements. Typically using a hammer, things like that can be really painful. And then you may feel that the hand is weak. You've lost some of your grip strength. And that's usually more if you've had it for a long period of time that you start losing some of your muscle strength. The pain from a golfer's elbow, you don't normally get it that you feel a sharp pain immediately. So it's not, say for instance you're playing tennis or you're playing golf or something, it's not that you feel, ooh, what have I just done? It gradually becomes painful over a session, or it's the next day after the activity that you feel, oh, my elbow's really hurting. If you feel a sharp sudden pain come on, you should think more on the lines of you may have torn something, but I'll talk about that in a minute a bit more. So that's how it feels if you've got golfer's elbow. Now, other conditions that feels very similar and that can create pain in this area is you've got a ligament there called the medial collateral ligament of the elbow. It's also the ulnar collateral ligament, another name. It's got several different names, but it's a ligament on the inside of the elbow. And especially in sports where you throw the ball or pitch the ball, you put a lot of strain through that. Gymnasts as well. Loads of other activities also strains the medial collateral ligament. And that ligament can tear. So remember, if you're getting a sudden sharp pain, you need to think, have I torn the tendons? Have I torn the ligament? Have it checked out. Nerve entrapment. So yes, nerve entrapment can be secondary to a golfer's elbow. So you can have golfer's elbow plus nerve entrapment, but you can also have that the nerves are stuck somewhere along the line because they come out from your neck between your vertebrae, then they run through the muscles in the neck, across the front of the shoulder, down the arm and various places, and it can basically get stuck anywhere along that line. So that's why I've got the ULNT stands for upper limb neural tension, and it means that as we move, our nerves in our arms are meant to slide along the arm. Now you can imagine if it's stuck somewhere, if you move your arm, you're now stretching and tugging on that. And it's often around the elbow that you'll feel that pain because it winds around the bones of the elbow there. So tight necks or muscles around the thorax or even in the arm can all cause different types of nerve entrapment. Carpal tunnel syndrome can also give similar symptoms, but you'll have a lot of tingling and there'll be a lot of pain in the hand usually if you've got carpal tunnel as well. And then plain old osteoarthritis of the elbow can cause pain in a very similar way to your golfer's elbow. And that's why it's useful to see a physiotherapist or doctor or somebody who specializes in this type of thing, that they can listen to the story you give them. But I'm actually getting ahead of myself because when we talk about diagnosing it, I'll explain to you. But they will be able to discern between all these different things and have a high suspicion of this or that, depending on what you say and depending on the tests that they do with you. So the different causes, I kind of touched on that already in the previous session. This is an overuse injury. What that means is you have used that muscle and the tendons so much that they haven't had enough time to recover. So now the tendon structure changes and it becomes a bit weaker and you get a tendinopathy in that tendon. If you've really gone and aggravated it, you can even get calcifications, which is little pieces of bone that form in the tendon, and that can be excruciatingly painful. So overuse is something that is really specific to the person. So for one person, say for instance you're used to weightlifting and you can easily lift a few hundred kilos. If you asked me to lift that, well, I wouldn't actually manage to lift it, but if I had to and I'd not trained for it, I would get an overuse injury from that. But because you've trained for it, you won't get one because you are fit enough and you're giving yourself enough rest in between sessions to do it. However, if you now want to ramp your training up and you have a steep increase in the volume of training you do, then you can get an overuse injury even if you've built up to it, because it may be that you're just doing too much too quickly. Same goes for classic one to get this is carpenters who's got a big project they're suddenly working on and there's a lot of hammering and a lot of, I know I had somebody where the nail guns really aggravated his golfer's elbow. So it's all about what you're used to and how much recovery time you give in between. Okay, so essentially just remember it's an overuse injury. Now, how do we know it's golfer's elbow? Do you need a scan? No, you don't necessarily need a scan. Ultrasound scans can be useful to confirm the diagnosis, but you can easily tell that it is that through just the history the patient gives and doing a few simple tests. So the things in the history that's important to listen to is things like the activities the person did to bring it on. How did that pain start? Was there a sudden sharp pain? Then you're going to be thinking more, I think there may be a tear rather than a tendinopathy. If they are also complaining of a really stiff neck and tingling maybe in different places, you may want to check, is there a nerve component with this? You can absolutely have nerve irritation plus a golfer's elbow. The two can be together. So, but both of them have to receive treatment and exercises then. Specifically for the golfer's elbow, you get pain when you compress the tendon, so where it attaches. That bit is painful if it is a golfer's elbow. If it's not painful in this area where it attaches or on the tendon, it's likely not a golfer's elbow. It's likely more something else that's creating pain in the same area. Then resisted wrist flexion. Why am I so struggling to get myself in? There we go, because it's a mirror image. Resisted wrist flexion means that you resist somebody pushing your wrist down. So that action, that will cause pain there because it's the muscles that controls the wrist flexion that attaches in that bit. So if it hurts to resist wrist flexion, you've likely got a golfer's elbow. Also pronation, so turning the arm in. So you resist, the patient tries to turn his arm in. If that hurts, it can be a golfer's elbow. And then also to stretch the muscles. And you stretch the muscles when you... Let me just get this camera back so I've got more space to play with. There we go. So that would be a stretch that can elicit pain. If it's really, I don't find that so sensitive. It has to be a really painful, really tight golfer's elbow for this stretch to actually cause pain there. But I have had patients where if you stretch the wrist down into extension, it causes pain in that area. Now, if you stretch it down and it causes a bit of pain, but it causes a lot of tingling as well, you would think again that you're stretching a nerve. Again, you can have both at the same time, but that may be a sign that you don't want to give stretches as the first instance as an exercise, and I'll talk to you a little bit more about that in a minute. Yes, and then it's just the scans that you don't really need. So the things in the history that tells you that it's likely a golfer's elbow, lot of hard physical work or work where you played a sport where they had to grip a lot, and there's usually a history of an increase in volume. The pain did not come on as a sudden sharp pain. It gradually appeared either through the session or the next morning woke up with the pain. And resisted wrist flexion is painful, as well as resisted pronation. Either or, it doesn't have to be both of them at the same time. And then stretch may also be painful, and it's painful where it attaches onto the medial epicondyle of the humerus. Interestingly enough, mine is painful, but I think that's from all the massaging. And there was an interesting study I found in any case of, they took a load of people who don't have golfer's elbow or symptoms of golfer's elbow, and they scanned their elbows, and they found that they had a high percentage of them had tendons that looked as if they had golfer's elbow. So there's again that thing of a silent tendinopathy, maybe, that some people can have it, but they don't actually have symptoms with it. Right. Yay, exciting bit. Treatments. So first of all, relative rest, like with all tendinopathies. This is an overuse injury. You cannot, if you develop the pain today, don't make the mistake of thinking, oh, I've heard on the internet or read on the internet, I need to exercise, I need to strengthen it because it's a weakness. No, 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 no. If that pain is a week or so old, that is still very much an overuse injury. And if you rest it and give it the right treatments in the next couple of weeks, it will recover so much better. If you're going to try and train it and immediately try and strengthen it, you will just make it worse. So you really need to seek guidance as to what exercises to do when. Exercise is the way to go, but not in that first instance immediately after you flared it up. If you try to do strength exercises, then you will likely make it worse. So relative rest means you're resting it from all the activities that aggravates it. So if that is gripping a mug, drinking coffee, then you grip the mug with the other hand for a few days. Okay. It means if it really hurts to hammer things in, if you don't have to do it for a living, then try not to do it. Get somebody else to do it. So relative rest is not do nothing. It just means take away the things that really hurt. So if it's okay to carry a few things back, shopping back from the shops, and it doesn't cause you more pain, by all means do it. But don't go carry heavy things that really sets it off. And for each person, the relative rest will be different. Because for some patients I've had, especially if they've had it for a while, it's only really heavy tasks that flare it up. Whereas for others, it's everything they do. So then they've got to be a lot more conservative with it. So it totally depends on what you can and cannot do at that point. For this type of tendinopathy, I find people usually come in, the patients have extremely tight forearm muscles. They often are so rock solid that I can't even get my finger in there properly. And I find if we can just decrease the muscle tone, that the muscles aren't that tight, we can get them a lot more comfortable quite quickly. So for me, decreasing the muscle tone and getting this more flexible and soft is my first line of treatment for acute golfer's elbows. I add in the exercise much later when I'm sure that this bit has calmed down properly. How do I get the muscle tone to release? Three main things. Massage, and that can be either self-massage or it can be a physio or a massage therapist doing the massage for you. Now again, it's massage on the muscles. It's not going and squashing that poor tendon on the bone because it's already painful. I know there's a school of thought that feels you need to do cross frictions over it to stimulate the healing process. But listen, if this tendon is a recently injured tendon, you do not have to stimulate the healing process at this point. You're just going to make it feel worse. Stay away from that tendon and do your massage over the soft bits, the muscle bits, and don't go and squash it on the bone. Honestly, your patient will do much better. If you're doing the massage yourself, same goes for you. There are loads of cool tools that you can use, balls and things that you can roll the arm over. But stay away from the bony bit. I know that's where it's sore and people like to prod it, but if you continuously prod it, it's like pressing on a bruise the whole time. You're just going to set the pain signals off the whole time. So loosen off the muscle bits, don't go and squash on the bone. Dry needling or Western acupuncture works really well to decrease the muscle tone. I've used it a lot in clinic as well. And then also I tend to give my patients gentle stretches to start with, but it's patient specific. If they're really, really painful, what I want them to feel is I want them to feel a muscle stretch. I do not want them to feel any pain in the tendon area. So the way I adapt that sometimes is I get them to bend the elbow and then stretch, which tends to give a stretch more in this area. As it becomes less sensitive, I tend to get them with a straight arm to stretch it then in that position. But to start with, I tend to get them to bend the elbow first and stretch it in that position. It's going to depend on the patient, it's going to depend on you yourself, but you shouldn't be getting pain at the tendon. You should feel a stretch in the muscly bit when you do that. Okay. I get them to hold it for about 30 seconds, but it's a gentle stretch. You don't take it to where you can maximally feel it. You just take it to where you feel the first stretch sensation and just keep it there. And I get them to do about 3 repetitions if they feel happy with that, and do it a few times in the day. It's quite useful as well if somebody has this condition and they've got to do a lot of typing, because typing can sometimes tighten that up even more. So it's useful to do it between, as little breaks in between. I always test the neck and the arm, how tight the rest of the muscles are, even if a person doesn't complain about that. So it's quite easy to test. You just check general flexibility, side to side, especially this one as well. And then I just look at normal, just shoulder range of movement. And it's as easy as adding in a few stretches and things for those if you find that there are an issue. Thoracic movements are quite useful to check for that as well. Just so that even if it's not the main thing, if you're really tight and sore there, because it holds onto the nerve a little bit, it may tighten things up higher up. So I always just check the whole line and give people stuff that they need, or if they don't need it, I just leave it out. Then my last part of my conservative treatment is the strength training. And strength training I make specific to the person in front of me. So it totally depends on what this person wants to get back to. If it is a person who doesn't really do regular weight training and stuff, it's not their dominant hand and they just got it because they did a lot of DIY, then I may not go that hot on the strength training. I will just make sure that they've got an adequate amount of strength versus the other side. If they are weightlifters, then you've got to be careful with how they go back to gripping the weights and stuff. And I usually decrease the load quite dramatically and just over a few weeks get them to introduce it back quite slowly again. But I tend to use whatever activity the person uses. If it's a person who's a carpenter or does that type of job, and they in any case have to use that arm the whole time, if it's an acute one and they haven't really lost much muscle strength, I wouldn't bother with strengthening it up, because the work that they're doing is already enough to strengthen it. But if they've had it for a long time and they've been overprotecting that arm and they've lost the muscle strength, then I will give them strength training exercises. But definitely look at when you get them to do it, that they don't go and overload. So if they're having really busy days, those aren't the days to do the strength training. If maybe it's better to do it over the weekend, or if they're having days where they work in the office versus outside, those may be the better days. So just look at when you give the exercises when they do it, so that they don't overuse it through doing the strength training again. Now, if conservative treatment doesn't work, there are different options available. For tennis elbow, I've had to send quite a few people on for other things to help them get over their pain. But for this condition, I've usually found that the combination of that, the massage and the dry needling and the stretching and stuff, usually is effective. But if it doesn't work, shockwave therapy can be quite effective as well. Tendon fenestration, that's quite a big word. All it means is that a doctor takes a needle and kind of pokes at the tendon like that, and they usually do it ultrasound guided, because you want to see where you're poking and that you're actually poking the tendon properly. And they usually do it in combination with injection type things as well. So sometimes you'll get a high volume injection that they just do that to disrupt. And the idea behind this is that you kickstart the healing process. Because this is a tendinopathy, you've got a breakdown of the tendon, you want to stimulate it that it actually heals and recovers. So there's some research that works for some people when they have tendinopathies that doesn't want to react to conservative treatment. And then I don't actually know how to say this word. I say autologous blood injection. Yeah, I say it so quickly that you don't know what I say. All that means is it's all the different blood mixtures. So PRP is one example of that, platelet-rich blood. So what they'll do is they'll take your own blood and they'll spin it and separate it off, that you get more platelets and more growth factor and things in that sample that they've got. And then they inject that into your tendon while they do the poking bit as well. And again, that can stimulate the body to then focus on that area and heal it. And there's not a lot of research available in golfer's elbow for that, but the initial research that is out there seems to show that it can be effective for some people. The general school of thought at the moment is avoid corticosteroid injections if you can. Steroids are extremely good at numbing pain quickly, but they do have an effect on the tendon that it actually weakens the tendon a bit, so you're more at risk of tearing it. So if you're going to go for cortisone injection, you've got to kind of decide what is your aim with this. So if you are somebody who doesn't do really high impact sports with your arm, but you just need to be pain-free for a business trip or something, it may be a good short-term solution to get a steroid injection, but then you still have to do the rehab after that very carefully. If you're somebody who does forceful movements with your arm, I would stay away from the corticosteroid injection, because you may end up tearing that tendon if you get that, because it tends to weaken it, and then you do a forceful movement on a weakened tendon. Then, yes, you can have surgery for that, but to be honest, I would seriously suggest that you do not consider surgery if you haven't tried any of the different injections, including a steroid injection first. Because what we're seeing through the research now, this has not been shown in golfer's elbow, but for a lot of other things like shoulder surgery, knee surgery, anything like those type of things, we've now got long-term studies showing that actually, if you look a year later, the people who had surgery is exactly the same outcome as the guys who didn't, who just had conservative treatment. So that's the same thing that I see with this type of condition is, if people really look after the elbow and they do everything the physio says and they get the right advice, some of them do need injections, but usually with the injection combined with the rehab and things, then they can get better. So be careful that you're not too quick and get fed up too quick and then go for surgery, because honestly, this is a condition that really can get better without surgery. So really think about whether you've done the right things first before you consider surgery. Excellent. So the main take-home message is, it is definitely not just golfers who gets golfer's elbow. It is totally treatable. There are a few things that can mimic golfer's elbow, so make sure you've got the right diagnosis. And then please, 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 if you develop your elbow pain now or quite recently, don't just jump into strength training. Get some guidance about it, because it can actually make your pain feel worse if you're too aggressive with it at the beginning. Now, if you need any help with your injuries, you're welcome to consult me via video call. A link is in the comments, in the description of the video. And yeah, if you've got any questions, just feel free to email me, comment, tag me if you can, and I'll get back to them. Have a good evening. Bye-bye.